Good morning. The time has come. I've been looking forward to this. Let's hope it goes well. Before I start, I want to this morning launch the Legs Matter campaign. You're at the TVS conference, Tissue Viability Society conference, but I want to stress this has been a collaborative effort over about 18 months by all the societies listed here. These are all not-for-profit companies or charities that have been working together since November 2016 to bring together what we're going to present to you this morning. We really hope you like it, we really hope you're going to run with it, and we really hope you're going to tell us what we can do to make it better, because this is the beginning of a journey. We know we haven't got this perfect. I said to somebody last night, I said it's a start. She said it's a very good start, but it is a start, so we really want to know. Right, let's see if we can get this to work. Okay. So we're a coalition of healthcare organisations. We've come together because, as you've heard this morning, we have real concerns about what's happening or not happening about caring for the lower leg. And we've banded together under the Legs Matter campaign. Now, Peter and co have done my job for me very nicely. We've talked about the guest paper. I don't need to go on about that. We've got the data there. We're not imagining this. You know when you start to think you're going nuts because does anybody else realise there's a problem? Yes, there is a problem. We're not imagining it. We've got good quality data. We've also heard about Betty's story. For those of you who haven't gone to this, I strongly encourage you. I've put the link there. Go and have a look. And I only came across that little YouTube video the other day. It's great. I got the whole family to watch it. They actually enjoyed it. They're not clinicians, but they really enjoyed listening to that. It's great. Go and have a look. Use it in your teaching. Do whatever you do. But we have the evidence. We know there's a clinical problem. We know there's a health economic problem. We need to be doing something about it. I want to tell you about a human problem. Let me introduce you to Douglas. Now, it's quite possible that some of you, anybody here from Nottingham? I know there's somebody here from Nottingham. You may know this man, I don't know. But you may have crossed your paths, you may not have. But this is Douglas, and I have got his permission to tell his story. 2016, he had cardiac bypass surgery. And the following February, the site on his leg where they'd harvested the vein started to break down. Not an unusual story. So he goes to see his GP, and he prescribes antibiotics. And it doesn't get any better, surprise, surprise. So he goes back and sees his GP again, and they give him more antibiotics. And then he starts seeing the practice nurse every week who tried lots of different dressings. It's almost Betty's story, you know, it's classic. Now in the background, his family were asking him to be referred to have a full assessment, including a Doppler. It took 6 months to get him from his first visit to getting to someone who could do a Doppler for him. And this, partly, Douglas did not want to make a fuss. Now, by the time Douglas finally received the right care, the wound had become chronic. We all know how hard it is to heal a chronic wound. Peter's just been talking about that. It's now improving, it still hasn't healed, and you know what? He's a bit fed up. The thing is, Douglas is my father-in-law. I could not get the right care for Douglas, even though I knew there are excellent tissue viability nurses in Nottingham. Even though Dame Professor Christine Moffat offered to see my father-in-law, but I couldn't get the GP to make that link. And if I can't do it, what the hell is it like? I said I wasn't going to swear, does that count? But what's it like for everybody else? And I am one of life's most pushy people about leg ulcers, as you all know, I couldn't get the right care for my own father-in-law. And I know this situation is far from unique. I can see lots of you nodding around the room. You've been there, haven't you? You know what I'm talking about. Now, before this story happened, a group of us had already started to get together to work on this project. I'm getting to a certain age, some of my colleagues are also getting to a certain age. We can start to see there is a possibility one day we will stop working. And it was really getting to us that we've been on this project for years and we still hadn't cracked it. We needed to do something different. Because as my husband says, if you keep on doing what you've always done, you always get what you've always got. It seems to be often true. We've been giving presentations, we've been doing education, we've been standing up here talking. It still wasn't changing. So what we decided to do was we would get together as a group of charities and not-for-profit organisations because we thought if we actually pool our resources and work collaboratively, we might achieve more than if we carry on working individually. We also decided, we knew that NHS England was developing this work. A lot of us have been involved in that work. And so we knew policy was really, really important. But actually, we could see things were starting to happen and we weren't sure. We could just campaign with the policymakers or we could take a slightly different tack. So we decided that we wanted to take that slightly different tack and we wanted to focus our attention on the information needs of patients, their friends and their families, because patients are central. So we need to do something for that. But then it occurred to us that if we were going to get the patients rallying and demanding better care, it was maybe only fair to also do something for the clinicians they would be presenting to. And I'm not talking to the people, well, there might be some of you in the room, but I'm talking about the people who maybe don't share our obsession with legs and with wounds. I'm talking about your practice nurse. I'm talking about your fairly newly qualified district nurse. Though I'm getting some of those fairly animated, but that's another story. But the community pharmacist, these patients must go into their local Boots or whatever and buy dressings for weeks before they go to along. We need to get these people, GPs, we need to get them knowing what is the right care. So we decided that's where we were going to focus our campaign. We hoped if we did this well, we would get the attention of the big policymakers, and certainly that seems to be what's happening, which is absolutely great. We know that with early appropriate care, most lower leg and foot problems can be improved. That's a really positive message, isn't it? You know, it's not doom and gloom. I'm not going to sit here today and show you lots of grotty pictures. I'm going to sit and say, actually, if we get this right early on, we really can make a difference. One of the big problems we've got is we're not getting this right early on, and we need to be doing it. We decided if we were going to develop a campaign like this, the first thing we need in this day and age is a website to support it. So what I'm going to present to you today is the website. I hope you've got your sunglasses on because it is bright, as you may have gathered. So, make a note of legsmatter.org. If you go on your phones, if you go on your tablets, whatever you've got with you, that is your new favourite this week, okay? Please. That makes me jump. That was not my IT skills, I will have you know. So from today, that website is live. And what I'm going to do is just walk you through some of it. But can you please go on, have a look, play with it, and then save it, and then send it to your friends, send it to wherever. And when I say the people you know, it's not just the tissue viability community. This has to go much wider. That's what we're needing to do. Get the message out there. So what have we got? Right, I did warn you it was bright. Front page. We know, as has been explained, every day thousands of people's quality of life is devastated by the lack of support and advice on how you look after the lower leg, problems with the lower legs. We want to change this. We know it's one of the biggest healthcare challenges. We believe everybody has the right to good quality lower leg and foot care. If you went to the doctor with anything else, you would expect to get good care, wouldn't you? Why are these patients not getting it? I do not understand. We need to improve awareness, we need to improve understanding, we need to improve treatments. And we can do far more by working together than we can individually. So, first priority was let's have a health and information section. Is it working? Yes, it is. Okay. Now, the health and information section is divided into two. On the one hand, you've got a whole section for family, patients, friends, carers, loved ones, whatever, members of the public. And on the other side, you've got a section for healthcare professionals. Now, this is written, the healthcare professionals is written, as I say, for generalists. We have not tried to write a textbook. What we've tried to do is get the essential information that is quick and easy for the people to understand. So let's have a look at the patient section first. There are lots and lots of different sections. It was developed with the input of patients. It's written in easy to understand language. It has a glossary in case we haven't explained properly well enough. It covers the most common signs and symptoms that indicate there is a problem with what's going on with your leg. But as you'll see, we also have a section for what's normal. Because actually, I'm having to come to terms with the fact that my skin is getting a little bit looser than it used to be. That is normal for my age. That is not a health problem. But at what point does it become a health problem? And that's what we try to explain. People put up with far too much for too long, don't they? Rather than seeking the help early on. So we look at what is normal, but we also look at lots of different symptoms. Let's have a look at one of them. Let's have a look, for argument's sake, dry, itchy skin. So if you click on that, it will take you to a section on dry, itchy skin. And you have got some very straightforward language there written about stuff. So say, for example, you're interested in the contact eczemas page. You're going to click on that bit there. Now, we are lazy. Well, we're also very busy people. Why reinvent the wheel? Do you know what? There's really good resources out there. So if you click on that, it takes you to NHS Choices, which has the section, which is written. Hopefully we trust NHS Choices. We haven't tried to redo stuff. We're just trying to signpost people, make it easy for them to find good quality information. So if we go to the healthcare professional section, it's laid out in a very similar way. And for example, let's look at dry, itchy skin for healthcare professionals. What do healthcare professionals need to know? And again, takes us to a similar thing, but this time you'll see it's written in more clinical speak, because we are assuming they have at least qualified, most of them. But of course, students would find this useful as well. I showed this to one of my colleagues the other day when we were testing, and she's a district nurse, and she said, oh, this is brilliant. She said, when I get my new students out, I'm going to sit them down with this. And you know when you actually got to give your students something to do useful, they can sit down, I'm going to give them a worksheet, they can work through, I'm expected to know a bit more by the time we go and see Mrs. Bloggs with her leg ulcer. Use it as a teaching resource. Okay, let's have a look at venous disease. I want to know a bit more about that. I don't know. I'm not actually sure what venous disease is. Click on it or just hover over it, takes you to the glossary. Want to know a bit more, you can click further and you can get even more information. The whole thing is very interactive. It is easy to navigate, trust me. I am the world's, if I can do it, you can do it. It's not difficult. Okay. So there's the glossary. Lots of information there. We've got other sections as well. If you scroll down the page, on the front page, you'll find we've got a section on publications and evidence. What we've posted here are some of the key documents that are available. At the moment, it's only the thing that is available without having to go. It's free, it's open access, you can get to it. We are going to be putting other things, though. I say we're at the start of this. There is important papers there that actually you do, unfortunately, aren't open access. Without wishing to blow my own trumpet, Professor Andrew Nelson and I did a really good piece in, I can't even remember what journal it's in, it's something reputable, and it's the most up-to-date knowledge summary. Unfortunately, it's that dreadful, you can't remember your own publications. But it's the most up-to-date summary that I'm aware of the evidence. It's a useful piece. Unfortunately, not our fault, we didn't have the money, it's behind a door. But we'll be posting that there, because a lot of you will be able to get to things because you're attached to universities, you can get this. At the moment, it's only open access. And again, if you know good papers you think should be there, let us know. Oh, there you go. So there's cellulitis, the cellulitis consensus document, which was published by the British Lymphology Society. Good paper, really, really useful. Easy way for you to find the key papers relevant, easy for you to tell your colleagues. If you go back to the home page, click on About Us. You might want to know, who the hell are these people? Who are these people? Well, so you can come and find out a bit about us. There is a section about key contacts. There's our mugshots there, a bit about who we are. But probably more useful to you is the information that we've been talking about this morning, Betty's story. You're trying to persuade your commissioners, they need to look at it. Click on there. It will take you, and I think that little video is posted, it'll take you straight through. We really hope this is going to become your one-stop shop for starting to find information. I'm a great believer in making life easy, and we really hope that's what this is going to do for you. Come back to the main page. Updates and events, and now this is where we particularly need your help. At the moment, this is a little scanty. At the moment, we're blowing our own trumpet, because why not? We wrote the website, we can blow our own trumpet. But actually, what we want to have here are things like study days that are coming up, really good online learning. I'm looking to the companies. I know at the moment this has been developed without company help, but we know some of the companies have really excellent online learning resources. We would love to signpost our users to your resources. So we'd like you to come and talk to us and see what might be possible. One of the sections, for example, we know we're missing at the moment. It's on I haven't told the team yet, I think it's our next to-do, ladies. Sorry, ladies and gentlemen. We need to write a section on compression. We haven't had time to do that yet, but I think that's what we need. That's what some of our user feedback came. It's on our list. But if you think we've forgotten something, you tell us. We will, I can't promise we'll do it overnight, but we will listen to you. I can promise that. So if you've got study days coming up that are local, that you want to get them out there, if your companies that are running study days about the lower legs, tell us. This is an option to be able to get that message out there. So we really need the feedback. Back to the home section, because I have to know which way I'm going. The other thing we'd like to do is to get our patients and clinicians involved. We think this needs political muscle behind it. As a group of us are going down to the House of Lords, I'm very excited because I've wanted to go to the Parliament for years, and I've actually been invited, which is great, without having to twist anybody's arm, which is even more surprising. But we think it needs more than this. We would like your patients to write to their MPs. Tell them what it's like to live with a leg ulcer. Tell them about stories that you haven't had the right care. We make it easy for you. If you click on that, it takes you straight to the thing that helps you work out who's your MP, and we even provide you with a draft letter that you can cut and paste or adapt as you wish into it. We've really got to put some effort into this. We're also going to have a section, again, I haven't looked today, so I can't remember what's there, but we're going to have patient stories, because people like to read about other people with similar problems. It takes some of the taboo out, but also you learn from each other. So what we're going to have in that section is the stories of how people have coped with living with their legs. We need your input for that. You know, I don't have access to patients anymore. I sit in the ivory towers of academia, so I don't have patients. A lot of my colleagues do, but a lot of you have patients. Tell us about what's going on in your world. Tell us when something goes great. Just when I look at the, Stop the Pressure, and they're always baking cakes for Stop the Pressure. Would you please bake some cakes for Legs Matter? Would you please stop wearing daft socks? You know, let's get out there. We're very creative people, are nurses. I'd say nurses, podiatrists, allied health professionals. Get out there, let's get this going, and let's animate it. A plea to our corporate partners. We really, really want to work with you. We haven't worked with you up to now because we needed to get our stall sorted out and in order, but we really want to work with you. We have forms. There's a stand just outside there. We're a little short on the leaflets because they may change. We have lots and lots. You know the little cards you can stick in your purse and your wallet? Please do not go home today without one of those in your bag. And I think we've got loads, haven't we? Yeah, we've got loads. Take some for your friends. Spread them about. Use them like confetti. In fact, my daughter's getting married next year. That's an idea, but there we go. I hope I won't have any left. Think about this. But the corporate partners, we have forms for you to fill in. We really would like to work with you. If you don't, it makes our job even easier and less likely to loss. There's an online form. Fill that one in, please. Communicate with us. Talk to us. Tell us what you think. Tell us how you can help us. We're getting wonderful offers of help. We have limited budget. You know, we've done all this on a very limited budget and a hell of a lot of weekend working. Is that about right, Brenda? Yeah. But what we do have, what we know that the companies have is huge reach. That's, please work with us with your networks to get this message out. And tell us what you think. We are genuinely interested in what you as practitioners think, what you think is missing, what needs to be improved. See if anybody else can find the misspelling of my surname, because I found it once, can't find it again, didn't have time to look. But if anybody could tell me which page it's on, I'd be very grateful, because that would save me 10 minutes. It's got an E in it at the end. We should have an E in it at the end. Those sort of things. Seriously, even if it's just a typo you spot, tell us. We won't take it personally. More eyes the better. If you've got a brilliant idea for a campaign, tell us. If you spot something we'd really like a section on this, tell us. If you've got a vocal patient who'd like to work with us, tell us. I'm going to drop my friend in it. I have a friend who I've known since I was 11, who's a GP. I have her permission to drop her in it. And I was chatting to her. She's a GP. And she's an average GP, and I don't mean that rudely. I mean, she's normal. She has a life. She has her dogs and everything else. She keeps a life balance. And I was chatting to her the other day, because she's my go-to when I want to know how to reach people like that. And I said to her, who do I need to speak to about blah, blah? And we got talking about leg ulcers. And she said, I'm really lucky, because where I work, we've got a really good district nursing team, and our commissioners have set it up. So if someone comes to see me with a gammy leg, I just immediately refer them to the district nurse. I said, that's brilliant, thank you. And she said, in fact, I've got a confession. She said, sometimes people come to see me about something else. They might have a hacking cough or whatever else, she said. And I happen to notice their legs are looking a bit dodgy. She said, so I refer them as well. She said, I probably shouldn't do that. And I said, no, that is exactly what we want people like you to be doing. I don't expect you to be an expert on leg ulcers. I expect you to spot something not right and get people to the right place. That's what we want. And I have got her permission to tell that story. So that's what we want, is we want the community pharmacist, Mrs. Smith's coming in buying dressings. We want them to actually say, actually, Mrs. Smith, have you heard about this? You might need a bit more than just coming and buying the dressings. We want the GP to be saying to the commissioners, look, I've got all these patients coming in, I don't know what to do with them, but I know there are people who do. How do we sort out the service? That's what we need. And I think I'll probably better stop talking. I've got 4 minutes, but I won't carry on. Please tell us what you like, tell us what needs improving, and please just take this campaign to your hearts and run with it, because we really need you. Thank you.
So we have time for a couple of questions or comments.
I stunned you all into silence. Are you going to do it? Yes. Can we have a bigger cheer? Are you going to do it? Yes. One more? Are you going to do it? Yes. Please, that'll do. I don't need any more questions. The stand's outside. Go and help yourself to stuff. Talk to us. And if the nurse is from Nottingham, I'd love to meet you. So please come and say hello to me. Thank you. Bye-bye.
Thank you very much.